every meeting, actually at the end of every meeting, everyone always comes up to us and says, when are you going to be back? When are you going to be back? I need you to come back. And so your wish has been granted through Virginia Mason. So Dr. Zeitler, you have to come up here and say a little something about your great program. We are hosting another meeting in December at Virginia Mason. During that time, that will be a perfect time for you to bring any of your accessories, get some individualized one-on-one time if you need it. But I wanted to, Dr. Zeitler to talk a little bit about his program and what they offer there. So.
All right, thanks.
Oh. Everyone was looking at me like. There you go.
So I wasn't expecting to say anything. I'll tell you a little bit about our program. I'm one of the 2 cochlear implant surgeons at Virginia Mason. We are the oldest cochlear implant center in the Pacific Northwest. We have done probably over 1,000, maybe 1,500 implants in the lifetime of our program. We offer, much to the dismay of everybody wearing red, all 3 devices at our center. We offer state-of-the-art of all 3 devices at our center, so we're going to implant the newest electrodes that are on the market. We are going to use the newest processors that are on the market. We have 3 dedicated pediatric and adult cochlear implant audiologists that work out of our center, and also one of our cochlear implant audiologists does work out of Federal Way a couple days a week for people who come from the South. Let's see what else. We are actively involved in both local, regional, national, and international research projects. We are currently funded by a few different grants where we're building a database of our cochlear implant patients and looking at outcomes and trying to predict outcomes for people who come into our office based on their length of deafness, based on their age, based on their other comorbidities, to try to predict who will and will not do well and who may do better with one implant versus another, if that exists. So that's it. We take just about every insurance, including Medicare and Medicaid. We do, I think there was a question that somebody had, we do offer bilateral implants, barring some testing and other things like that, but we don't hesitate to offer a second side if the patient still meets the criteria for insurance companies. Anything else I should?
That's great.
No?
Yeah.
All right.
No, I just want to know your associate's name is
What?
My associate is Seth Schwartz, that's correct, yes. Oh, good.
5 years.
All right, good. Congratulations.
Sure, go ahead.
William, where I go now, they tell me that I cannot have a second cochlear implant.
Mhm.
Is it possible to come to Virginia Mason?
Mhm.
What do I do?
Happy to have you.
Repeat the question.
Oh, the question is, she was told by the center where she currently has her implant service that they do not offer a second side. Could she come see us? And I said yes. It depends on your insurance. You may require a referral from your primary care physician. Really what you should do is call, I don't know, do you know the number for Listen for Life Center? 8880 or something? Anyways, we can get you I don't know the number directly to the Listen for Life Center. We can get that for you. You would just call and speak to one of the 2 gals that works at the desk there, and they could tell you based on your insurance if you need a referral or if you don't. The one thing that we will require if you have already been implanted is before you would get an appointment, we would need your old records to review them.
Well, they said I could go someplace else.
Sure.
It seemed.
Yeah, you would just need to get your most recent maps. I mean, if the idea is for you to transfer your entire care into our center, we would need, obviously, your recent maps.
So that's what I could do.
So if that's a thought you have, you may want to start gathering those data and
Okay.
have them ready. Yeah, but we're happy to see you. You know, I think for Medicare, the real question for Medicare, the problem with Medicare is
I
they
know.
don't pre-authorize any surgery. Now, some Medicare products do, if it's an HMO Medicare, but if you're just straight Medicare Part B, then they don't.
A and B.
A and B,
I have
correct.
supplemental too.
So, but if you're straight Medicare A and B, they don't pre-authorize a surgery. So the problem is, the reason why a lot of centers are hesitant to do a second side is because we can't guarantee that we will get paid. We also can't guarantee that you won't have to pay, because they don't say yes or no beforehand, like a private payer would. So that's why we always kind of caution patients and we say, look, you know, if you're a candidate, you just have to assume the risk that you could get a bill in the mail, but we, knock on wood, have never had a patient have that. I think the bigger question is how well you're doing with the first implant. If you're doing really, really well, sometimes we say, well, maybe it's not worth taking that risk. If you're not doing really, really well, then we say, maybe it is worth taking that risk, and that's why we would do the testing and kind of help you decide. But categorically, we don't say no. I mean, it depends on a lot of other